every year, World Mental Health Day is commemorated on October 10th around the globe. This day aims to raise awareness about mental health, its significance in life, and the reasons why people should never ignore their mental health problems. The COVID-19 pandemic placed immense pressure on mental health care services globally, while an increased number of people couldn't access a treatment and support, experiencing heightened mental distress during stay-at-home restrictions. Now, let's discuss this further. We are now joined via Zoom by Cassey Chambers. She's Operations Director of the South African Depression and Anxiety Group. Cassey, thank you so much for your time this afternoon. Now, it is quite worrying that when you're seeing those reports that are placing Africa as a continent at very high levels in terms of, dealing with issues of mental health, particularly depression and suicide and anxiety. Is it because, particularly in South Africa, there is a problem in identifying mental health problems, that is?
Good afternoon. I think it's a combination of different issues that we see. In South Africa, if we look at pre-COVID, we were already under a lot of strain in our mental health system, not having enough hospitals, enough mental health professionals, battling with medication stockouts. And then COVID hit and had a direct impact on people's mental health. From the WHO, they've estimated that between 25 and 35% increase in depression and anxiety. So therefore, our levels have definitely increased over the last 2.5 years. But what we're really struggling with now is not having enough resources or access. So people may identify signs and symptoms. We're dealing with a bit more stigma with people that are reluctant to reach out for help or know where to go, and then having access in their communities. When we look at the treatment gap with regards to mental health in South Africa, only 1 in 10 people with a mental health issue have access to treatment, which means 9 out of 10 people with a mental health issue do not have access. And we as a country have to do a lot better to make sure that those that do identify with mental health issues are able to access care.
Could it be, just in terms of those numbers, that the National Health Department is not placing enough of its budget, in dealing with mental health issues? I understand, and I stand to be corrected, that around 5% of the entire budget goes to mental health.
That is correct. What we know, because not every provincial province is able to give us their provincial budget for mental health spend or expenditure. What we do know is that less than 5% of the budget is allocated to mental health, and the majority of that budget is allocated to inpatient psychiatric care. However, there isn't enough invested in community mental health programs, making sure that our primary healthcare clinics are equipped with mental health professionals and medication and access. And that's where we're hitting the biggest problem, is that people on the ground are not able to access that care. And this is what we're really hoping for World Mental Health Day, is to really urge our governments from a national and a provincial level to invest more money, to allocate more money to our mental health care programs, looking at increasing the number of psychiatric beds at our hospitals, increasing more placements for mental health professionals, and making sure that we do have a community mental health program in all of our provinces across the country, because we know that mental health does not discriminate. And often the people in rural areas are the most affected, and those that do not have access to care.
And what is worrying, is that South Africa is placed 10th in terms of global suicides, and we're seeing more younger children, committing suicide, even some as young as 10 years old. That is worrying. But I think added to that is, once you identify that there is a problem, particularly when you speak about children, the access to getting help that they need isn't there. And I think that was exacerbated by COVID-19.
Absolutely. We as adults were so impacted. We underestimated the impact on our children. And we've seen a huge increase in depression and anxiety amongst our adolescents, even as children and in primary school level. And this is where we need specialized mental health services to help children and help adolescents. We also know, as you mentioned, South Africa has very high suicide rates, which show us that untreated or undiagnosed mental health issues can lead to things like suicide, and we want to prevent that. We also know that the most at-risk age group for suicide in South Africa is amongst our adolescents, and young adults are more diagnosed with mental health issues than other age groups. So it's really important that we're investing and we have a mental health strategy in providing support to our young people in South Africa. So when they're needing to see a mental health professional, we have more children or adolescent psychiatric care available for them, more beds allocated to them, so that we can intervene early on and get them on proper treatment and support before it has a profound impact on their functioning, their family, or in the worst case scenario, even leads to suicide.
So what is the reality then for South Africans when we know that, anxiety and depression are some of the top, mental health problems that we are seeing? We're told 1 in every 8 people in the globe, suffer from mental health. What then is a reality for somebody in this country to get the help that they need and get it fast? I'm asking you this question in relation to the numbers we were talking about in terms of how much the budget actually goes to this to mental health problems. And also just recently Premier Panyaza Lesufi announcing that the Department of Health in Gauteng will now also extend to the Department of Health and Wellness, which is a very important point, but how much of that will actually help realistically?
When we're looking at South Africa, as you mentioned, the global figure is 1 in 8 around the globe that have a mental health condition. In South Africa, it's 1 in 3. So we have to have more intentional mental health strategies and programs. And we welcome, extending our Gauteng Department of Health into health and wellness and well-being. We have to also put our money where our mouth is and make sure that we're investing in programs, and not just in Gauteng, but in other provinces around the country. We know also that if we don't invest in mental health and we try to scale back or often save on the mental health budget, it can lead to serious consequences, as we had a couple of years ago with life esidimeni. But on the ground, patients are struggling regularly to be admitted into hospitals because of the long waiting periods, or not having access to beds, or being turned away from clinics because there isn't stock of their medication, or not even having access to a mental health professional, a psychiatrist, a psychologist, or a counselor at their local clinic. And we have to, with the number of people that are impacted, as well as the increase that is estimated globally post-COVID, we have to do more. And this is where, as a national body, we have to put and implement a national mental health strategy to ensure that we are investing more resources, more in financial investment into mental health, so that we can help the infrastructure. We were in a mental health crisis before COVID. COVID has profoundly, exponentially impacted mental health. We have to do so much more to make sure that people who are affected in our communities get that help, not only for themselves, but for their families and their communities, because we know that mental health doesn't just affect the individual. And this is why it's so important that we're using the theme for World Mental Health Day as prioritizing mental health. So whether it be local, provincial or national Department of Health, or corporates or medical aids or pharmaceuticals, we all have to prioritize mental health and come together to make sure that we're putting mental health first.
Cassey, thank you so much for your time this afternoon. Really do appreciate it. Cassey Chambers, Operations Director of the South African Depression and Anxiety Group. Of course, tomorrow, the 10th of October, marks Mental Health Awareness Day. And the theme, as Cassey said, is make mental health and well-being for all a global priority. Thank you so much.